Welcome ladies and gentlemen into today's video, and today we will be touching upon the guidelines of supraventricular tachycardia. The following are key points to remember about the 2015 guidelines for the management of adult patients with supraventricular tachycardias. The first one is that for the purpose of this document, the term SVT includes any arrhythmia originating above and including the bundle of His and specifically exclude atrial fibrillation. Paroxysmal SVT is a regular and typically narrow complex tachycardia that is characterized by sudden onset and termination. Its causes include atrioventricular nodal reentrant tachycardia, orthodromic atrioventricular reentrant tachycardia utilizing an accessory pathway, and atrial tachycardia. Patients with recurrent bouts of symptomatic paroxysmal SVT should be considered for electrophysiologic study and catheter ablation. The third point is the most common tachycardia in patients with the Wolff-Parkinson-White syndrome is orthodromic AVRT. AVRT can occur in patients without pre-excitation on the resting electrocardiogram. In these cases, anterograde conduction over the pathway is not possible or very slow, and the pathway is referred to as concealed as opposed to manifest. The fourth point is atrial fibrillation with extremely rapid conduction over the accessory pathway, that is pre-excited AF, can lead to syncope and sudden death. Sudden death is more likely to occur in patients with a history of tachycardia, that is with prior symptoms, but may be the first manifestation of the accessory pathway. Patients with pre-excited AF and who are otherwise hemodynamically stable should be treated with intravenous abutolide or procainamide. Intravenous digoxin, intravenous imidazole, intravenous or oral and beta and calcium channel blockers may lead to extremely rapid conduction over the accessory pathway and hemodynamic compromise in patients with pre-excited AF and thus should be avoided. Oral beta or calcium channel blocker therapy is reasonable for ongoing treatment of AVRT in patients without pre-excitation on the resting ECG. Patients with asymptomatic pre-excitation on a 12-lead ECG are said to have a WPW pattern. Patients with intermittent pre-excitation on the resting ECG or abrupt loss of pre-excitation during exercise testing are considered to be at low risk for life-threatening arrhythmias. Other patients may be considered for electrophysiologic study for risk stratification. Catheter ablation of the accessory pathway should be performed if high-risk features are found on the EP testing. It is also reasonable to observe patients with a WPW pattern without further evaluation. It is reasonable to consider catheter ablation in individuals who are unable to secure employment, for example pilots, because of a WPW pattern. The sixth point is that catheter ablation of the cavo-tricuspid isthmus should be considered in patients with symptomatic atrial flutter or those in whom the rate cannot be controlled with medical therapy. Patients undergoing catheter ablation of the cavo-tricuspid isthmus should be considered counseled that there is a reasonable chance that they may develop AF during follow-up. Oral anticoagulation for stroke prevention in patients with atrial flutter should be prescribed according to the patient's risk factors using the common risk stratification schemes for patients with atrial fibrillation. The seventh point is that the resting heart rate in patients with inappropriate sinus tachycardia is typically more than 100 beats per minute. A diagnosis of inappropriate sinus tachycardia is made after excluding conditions associated with a heightened sympathetic tone. It is also important to evaluate the possibility of postural orthostatic tachycardia syndrome in patients with IST, as the use of beta blockers may exacerbate the symptoms in the former and may be helpful in the latter. Ivabradine, an inhibitor of the IF channels, reduces sinus node aromaticity and is useful in patients with IST. Patients with adult congenital heart disease and atrial tachycardia